the case for health and safety management systems. The case for robust management of health and safety is sadly compelling. Statistics published by health and safety executives suggest over 130 fatalities a year, nearly 80,000 injuries a year, 1.2 million people suffering from work-related illnesses, nearly 30 million days lost, the cost of which equates to over 14 billion a year. A health and safety management system is your organisation's book of best health and safety practice. It shows that the managers and directors of the company have properly considered the risks associated with the activities the organisation carries out. And ideally, it would be integrated with any other standards and system you also hold. And whilst these days it's usually made available to staff electronically, some companies like to hold a hard copy. All management systems are interested in planning and objective setting for health and safety, how health and safety is communicated and consulted on, who is responsible and how competence is demonstrated, how and where information is disseminated, recorded and stored. Crucially, it's also interested in how health and safety activities and processes are improved. So, let's start with the planning. All organisations will have things they want to do, and these will often affect the way in which the work is done, that is, the activities or processes undertaken. The objective is safer practices, but practices might need to change with new customers, perhaps undertaking different activities, or more staff working together doing different things. Simply changing the office might introduce new risks. New staff, bigger transport fleets, new products and processes can all potentially introduce new risks. All organisations will undertake processes or activities which carry a degree of risk to a greater or lesser extent. Directors and managers have a legal obligation to manage those risks, regardless of the formal management system. The humble and low-risk office environment in the professional services sector typically accounts for over 30% of all slips, trips and falls. Driving and construction work are more dangerous still. So what would a health and safety management system cover? There are two key activities: business as usual activities and improvement activities, to which we will return. Business as usual activities might include driving, working on site, transport, working in the office or in a factory, and working with electricity, to name just a few. A robust management system and the law requires you to assess the activities you undertake and ensure the safety of staff, clients and the public. That means for each of the activities and tasks you ask your staff to undertake, you need to identify the hazards and manage the risks identified. However, a robust management system also requires a series of improvement activities designed to ensure you learn from your problems and mistakes. This might include accidents, incidents, and near misses. Audits, a formal review of the effectiveness of your systems. Essentially, these processes are designed to help you improve the way in which your health and safety work works. So how do you get there? Write down what you do, your policies, procedures, risk assessment, and method statements. Justify what you do, which would involve consulting with the staff that actually undertake the work. Do what is written, and record what you have done. But a robust management system requires a little bit more. You need to review what you have done to see if further improvements can be made. Revise the book of best practice to hold any gains. Once you are ready, there are a number of well-known certification agencies, each of whom undertake the whole raft of management system certification work. These agencies include BSI, NQA, LRQA, and DMV, and to be legitimate, in the UK, they will need to be UCAS approved. Getting assessed is a two-stage process. The document or system review, a check to see that your system covers the elements of the standard. The operational review, to check that your health and safety systems are actually working as your systems suggest. These stages are typically 6 to 8 weeks apart. Inevitably, there are usually some issues to address, but the most usual outcome is recommended for registration, which means there are minor things to be fixed before the certificate is awarded. You then can celebrate the registration and all the hard work that has been undertaken, not forgetting that one assessment some time ago, one assessor remarked, "The 100-yard dash is over, let the marathon begin." The benefits are considerable, not least you and your staff going home to your families at night, but also improved image, often lower insurance premiums, banks and investors being willing to provide finance, customers having increased confidence. Reduced accidents and incidents and their associated costs, reduced chance of contravening legislation, reduced chance of fines and litigation, improved staff morale, and a chance that if something nasty does happen, the authorities will see the system as well managed and will take a lighter touch because it really was an accident. Statius can be viewed as your driving instructor. We'll assist you all the way up to and past your driving test with any UCAS approved driving examiner. At Statius we can help. We can be viewed as your driving instructor. We work with you to develop simple user-friendly systems. We use your terminology and language, not the standards. We make the standard fit your business. Let Statius help you realise the benefits of a robust management system. Have a look at our website on www.statius.co.uk or call us on 020 8460 3345. We'd love to have a chat.